Hey you guys, it's me, Miss Fighting Fiercely, your favorite endometriosis awareness advocate, and I am so excited because today is March 1st, and so y'all know what that means. Bam! It is Endometriosis Awareness Month. It is time to fight fiercely all month long for the entire month of March, even though for us, our awareness is all month long. But March is the official Endometriosis Awareness Month, and so I wanted to come to you guys to just drop a little bit of info on what I'm going to be doing for you guys during this month. So the first thing I want to address is a lot of you guys have inbox me or message me or ask me about the expo, the Fighting Fiercely expo that we normally do. And unfortunately, no, we're not going to be doing the expo this year. I know a lot of you guys were looking forward to that, but you guys, most of you who have been following me for a while, you guys know that I've had a lot of health challenges and issues with the endo and adneo since last year rolling into this year, and I was actually scheduled to be in surgery around this time of the year. So I didn't make any plans to prep the expo because I actually thought that I was going to be in the hospital. And so in lieu of the expo, initially I'd planned to host a screening here in Chicago for the endometriosis documentary, Endo What? But then some other unforeseen circumstances came about, and so I actually had to postpone the screening of the movie. But we will reconvene, and I'll definitely bring the screening to you guys as soon as I'm able to. But I'm not going to leave you guys hanging. So in lieu of the expo, in lieu of the screening, I am going to be bringing you guys all of my endometriosis awareness efforts this month virtually, which I think might be better for a lot of you guys, because that way a lot of you sisters from out of state, other cities, even in other countries, can connect and join in without having to actually be here. So I still have some great stuff in store for you guys every day this week. Obviously, on the social media websites, I'm going to be posting links and articles and information to expand your awareness regarding what endometriosis is, who it affects, how it affects you, what can you do to have a manageable and good quality of life while you are managing this disease. I'm going to talk about how it affects you mentally, emotionally, sexually, how it affects your relationships, socially, and just all kinds of great things. I'm going to be collaborating with some other sisters to hopefully bring them into some of the live chats to talk about their books, their projects, their awareness efforts. I'm in the process of planning to revamp the intimacy workshop that I've done the past 2 years and bring that to you guys virtually. I know several of you have asked about that as well. So I'm not going to leave you guys high and dry for Endometriosis Awareness Month. We're still going to do some awesome things and have a fabulous time and educate, enlighten, and empower the people for Endometriosis Awareness Month. So with this being the first day of Endometriosis Awareness Month, I always like to start every year by kind of breaking down for you guys what is endometriosis. And the source, my reference source that I'm going to be using here is from the Endometriosis Association, of which I'm a proud member. Hey, a member volunteer for them. I love working with the Endometriosis Association. They're a great group, a starting point if you've been diagnosed with endo and don't know where to turn, don't know where to go to get information, and you want to just kind of get a handle on things, get a grasp on things. The Endometriosis Association is an awesome resource for you. So here we go. Day one, what is endometriosis? So in layman's terms, obviously I'm not a doctor, as basic and as level 1 as I can make it, right? So endometriosis is a debilitating reproductive disorder by which tissue that mimics that which is in the lining of the uterus. So it is not the lining of the uterus. It is not the endometrium itself, right? So the tissue that lines the inside of the uterus is called the endometrium, right? So endometriosis occurs when tissue that mimics that. It's not the same. It's kind of like a mutated version of that, but it's similar to the tissue that lines the uterus. Somehow, some way, they haven't figured it out. We don't know how yet, but it finds its way outside of the uterus, and it embeds itself in other areas throughout the pelvic and reproductive cavity and other areas of the body as well, right? We don't know how that happens. So why does that matter? Is it important? So within the uterus, so every month when a woman has her monthly cycle, her period, in preparation of conception, that lining of the uterus, it thickens and it builds and it waits for the sperm to come along and fertilize the egg, right? If that does not happen, that lining builds up, breaks down, sheds, and bleeds out, and that is what we call our period, right? Well, when a woman who has endometriosis, that tissue that is displaced in other areas of the body, it behaves the same way. So what happens? It builds up, it sheds, it breaks down, and it bleeds. But because it is not in the uterus, it has no way to exit the body. So that means that the woman is essentially bleeding internally month after month after month. That old dry blood, it congeals, it solidifies, it infiltrates and binds, adheres, it sticks to other organs in the body, other ligaments, other tendons. It creates fluid-filled cysts called endometriomas, or chocolate cysts or chocolate tumors, they may be referred to. They can harden, they can grow, they can get extremely large, which in turn it can press up against other organs. It can impede the other organs in the body from functioning properly the way that they're supposed to. And it can cause all kinds of secondary, like snowball comorbidity conditions. And so what does that mean for the woman? Most times heavy bleeding, excruciating bleeding, very large passing of blood clots. When I talk about excruciating bleeding, I'm talking about you're filling up the largest pad that you can think of. You're soaking clean through that in less than an hour, going through a 24 or 36 pack of pads that's supposed to last you for 4 months, going through that in about a week. So you're bleeding, you're passing blood clots, you're experiencing severe debilitating abdominal pelvic pain, sharp pains, stabbing pains, almost labor, uterine contraction type pains a lot of the times, anemia, extreme fatigue, migraines, bowel problems eliminating waste during that time of the month. All of those conditions can happen as a result of being stricken with endometriosis. And although most of the time it is relegated to the reproductive area or the pelvic area, that's not the only place where endometriosis can be found. Endometriosis can be found in the ovaries, in the fallopian tubes, in the rectum, in the vaginal canal, in other areas, sometimes the intestines, sometimes on the bladder, the cervix. In rare cases, it's been found in the lungs. In even rarer cases, it has been found in the brain. So it doesn't just sit in the pelvic cavity. And that's one of the reasons why you hear me talk a lot about hysterectomy is not a cure for endo, because if you get a hysterectomy and remove the uterus, but you've got it in your kidneys, your lungs, or your bladder, you're still going to be affected. Getting a hysterectomy isn't going to do anything for the endo that's present in those areas. And so that's why you often hear me and other endo sisters say, it's not just a bad period, because a lot of times it has nothing to do with your period. You have women who have had a hysterectomy, who the uterus is removed, or women like myself who are on suppressive birth control therapy, who don't even get a period, but we still have varying degrees of debilitating pain each and every single day of our lives. So that, in a nutshell, is what endometriosis is. So it generally revolves around the reproductive cavity and uterus, but there's so many other areas to where it extends beyond that. So where does endometriosis come from? We don't know. And it's very frustrating to know that in 2018, we still don't have a definitive cause for endometriosis, given the fact that the first case of endometriosis was actually documented and discovered back in the 1800s. And so here we are 2 millennia later, and still no cause, still no cure for endometriosis. There, throughout the years, have been several theories that have since been disproven. One of the most popular ones is the retrograde menstruation, the Samson retrograde theory. That's been bust out of the water. They used to think that there were myths saying that if you had multiple pregnancies, or if you had an abortion, or if you were highly sexually active, that's what caused endometriosis. All of those things have since been disproven, which is funny because there was a time where it was called, like, I think, white women's disease or a nun's disease, where they were finding it a lot in nuns or women who had never had sex. So on the one hand, they're like, oh, if you're having too much sex, it causes endo. Then if you've never had sex, not having enough sex, it causes endometriosis. So, but all of these theories have been disproven as to what the cause of endometriosis is. Although in recent years there have been research that points to genetic components that show that endometriosis is actually laid down in the womb as a fetus. They've been research where they've shown endometriosis to be present in a fetus. Also, if your mother or grandmother or immediate female family members have history, there's research to show that you can be at a higher disposition to have it as well. And in 1992, and I'm just in my notes here, research that was spearheaded by the Endometriosis Association did show strong connections to environmental toxins such as dioxin and PCBs, which can act like hormones within the immune system and potentially cause endometriosis. Dioxins are highly toxic chemicals that come from things like pesticides and herbicides and use of hazardous waste incineration, manufacturing chemicals and plastics, and also related to paper and pulp production. Also hormones and contaminants within food, and animals and fish, which is why a lot of the times you'll hear us talk about the endo diet and why it's important for a lot of sisters to either eliminate certain foods or add certain foods to the diet in order to help manage that pain and that inflammation. And this component, the chemical component and the pesticide component, is particularly affecting to women of color and to our communities and poorer communities, because a lot of us live in food deserts. We live in medicine deserts. So we don't have a lot of access to green cleaning products or green, healthy fresh fruits and vegetables that have not been sprayed with herbicides or, pesticides. And so that it can be a component in our delayed diagnosis. Also, given the fact that a lot of us don't have access to adequate medical care. And when we do go, we're often told, it's part of being a woman, suck it up, take a Tylenol and have a seat, so misdiagnosis, underdiagnosis often leads to that 8 to 12 year delay before receiving accurate diagnosis for women with endometriosis. And so, no definitive cause yet, but there are theories that are starting to point to very specific things. Now, we've covered the symptoms, what causes it, diagnosis. The only definitive way to diagnose endometriosis is through a laparoscopic surgery, which is basically where they go in with a camera and look to see. But you want to have it done by a skilled excision surgery, because most OB-GYNs, most doctors, most, OBGYNs, they're not trained to see it, to find it, to know what it looks like. A lot of women have had laps done by regular OB-GYNs and they're like, no, you don't have endo, and then they'll have it done by a specialist and their bodies will be riddled with it. So it's important to get the proper diagnosis. It can be suspected through like an MRI or maybe an ultrasound. But again, this disease mimics so many other things like fibroids, PCOS, even irritable bowel syndrome or cervical cancers. And so a lot of those things present similarly on ultrasounds or MRIs, which is why it's important to get a definitive diagnostic lab to be certain that you have endo. So what do we do about endo if you have it, if you've been diagnosed with it? Unfortunately, again, 2 millennia later, there's still no cure for endo. And I'm going to say it, and I'm going to say it, and I'm going to keep saying it. There is no definitive cure for endometriosis. Yes, you can go into periods of remission or symptom repression. You can be symptom-free for many years, but as I always stress, absence of symptoms does not mean absence of pathology. There is no definitive cure for endometriosis. There are a variety of treatment options, which range from basically pain management. In all these decades, they've only been able to come up with giving us drugs, which is unfortunate in recent years because of the opioid crisis. And so pretty much the spectrum of what they've given us to treat our disease is drugs. Everything from high dose ibuprofen all the way to morphine or fentanyl or Dilaudid for some women. And because of the opioid crisis, a lot of doctors are pulling back. They're becoming more restrictive. They're not prescribing either enough or correct dosages to be able to effectively manage the pain for women. And so as a result, a lot more women are starting to suffer. And so in addition to pain management drugs, there are hormone drug options which do varying things to your body. I'll say you guys have heard me talk often about Lupron and my experience with that. That's a commonly prescribed drug. I am not a fan. I am not an advocate, but I'll talk about that in another video. But it has provided relief for some women. But the thing to note is that even with the drugs, even with the Lupron, all of the symptom relief is only temporary. It manages pain, it does manage symptoms, but it has no effect on the pathology or the presence of the disease itself. As of now, the most definitive, what's considered to be the gold standard of treatment regarding endometriosis is excision surgery. That is the surgery that I had with my initial diagnosis back in 2008. That's the surgery that I had last year, which is basically when they go in and cut out and remove the disease from the deep infiltrating embedded layers. It's kind of like yanking it up from the root. And if done successfully by a skilled surgeon, it can drop the reoccurrence rates to between 15 and 20%. So some women have gotten substantial relief via excision surgery. But even with that, some women have to have multiple surgeries because the disease, it does come back. And we'll talk about that in another video, the progression of the disease and why it's no cure and why hysterectomy is not a cure. And for some women, even though they realize that hysterectomy is not a cure, the fact that they don't have to have a period every month provides them significant relief, and it does alleviate a big chunk of their symptoms. So those are the main treatment options. But again, it's not a cure. And most women, myself included, we tend to use a combination of treatments. We use some form of drugs and surgery and diet and exercise and hormones and acupuncture and alternative and complementary therapies to give us relief, which kind of sucks, because it can be kind of quite complicated hi, Crystal. It can be very complicated to figure out how to manage this disease. But thankfully, research is moving in that direction. And with the different treatment options, most women can kind of find a different combination of things that work for them. But unfortunately, for now, there's still no cure. So we've covered symptoms, diagnosis, the causes, and treatments. So hopefully I've given you some insight. It kind of expanded your awareness of what endometriosis is and how it affects different women in the different areas to which we are affected by it. And I always like to start day one with explaining what endometriosis is, because even some women who have it, when I talk to them, they're like, I have it and I didn't even know, that it was this involved or it was this complicated. Or some women will say, I heard of it, but, I thought it was just, a period. And so often you'll hear other sisters say our tagline, it is not just a bad period. It extends far, far, far beyond that. And to say that it's, it's just a bad period or it's just related to your period is to really minimize the severity of this disease and the debilitating effect that it has on the women and the young girls and the teenagers who suffer from this disease. So I just wanted to give you that breakdown, the overview of what endometriosis is all month long. Probably I'm going to shoot for like 2 to 3 times a week to give you a video discussing different topics about endometriosis. So be sure to follow the page for the live streams, for the posts, the information, the articles, the different endo sisters and experts that I'm going to try to connect with and bring to you via the live streams as well. Feel free to ask me any questions on the Fighting Fiercely page. You can inbox me. That is what I do as part of my Educational Awareness Forum. That's what Fighting Fiercely is. Yeah, let me backtrack and do that. For those of you who are new to the page or just coming here, hi, Crystal. I was diagnosed in 2008. So I've been pushing this now for 10 years now. So welcome. Thank you so much for stopping by. But for those of you who don't know, I am Michelle N. Johnson. I am the author of Fighting Fiercely, Unveiling the Unknown about Endometriosis, and my educational awareness movement of the same name, Fighting Fiercely. And my goal, my mission is to educate, enlighten, and empower not only women and girls diagnosed with this disease, but also their family, friends, loved ones, significant others, girlfriends, boo things, everybody in their community. My job is to teach them how to create a safe space of support for women who have been diagnosed with this disease, and to help them understand that this is a whole family disease. This is a community disease. It does not just affect the women who have it. And so I teach them how to work together to, number one, advocate for themselves, how to find a proper specialist, how to be their own voice in deciding the course of treatment that they want. I teach partners and couples how to maintain unique forms of intimacy when the good old school fashioned ways don't work because of endometriosis or adenomyosis. I teach you guys how to be empathetic, not sympathetic. We don't want sympathy. We don't want you to feel bad for us, but to give you guys a clearer vision of what the women who are suffering through this go through, so that you guys can have a safe space. They can have a space of support, and they can learn not just to live with the disease, not just to manage, not just to be okay, but to thrive with this disease. And that's part of the reason it's called Fighting Fiercely, because I teach women that you can still be fierce, you can still be fabulous, you can still be very feminine while you are going through this fight, right? You're fighting fiercely, you're fighting aggressively, but you're also fighting fiercely, right? We still looking good, we still looking cute out here, even though our insides are a hot mess sometimes, right? And so that is my mission. That is what Fighting Fiercely is about. So like I said, I'm here to support, I'm here to listen. So inbox me, reach out to me. You guys can send me a friend request, and I am here all month. So I hope this was a good start, day one for endo awareness for you guys. But I am here for you to educate, enlighten, and empower you guys. And I'm really excited about all the virtual stuff that's going to be going on. So if you haven't already, like the page. If you're on Instagram or Twitter, follow me there. I am at Fight Fierce Endo on both Instagram and Twitter. I am facebook.com/fighting fiercely. And also be sure to check out my website, www.fightingfiercely.com. You can check out the gallery there from our past expo events, because some of you guys were inquiring. You can purchase the book from the page, Fighting Fiercely. You can also grab the book. It's on Amazon.com. The paperback and the Kindle version are available for you also on Amazon.com. You can also get the book through the website, Fighting Fiercely. But thank you guys for giving me just a few minutes of your time today. So I hope you have a better understanding of what endo is, and tell somebody, tag a friend. If you know somebody who has it, go to them and say, girl, I just learned today it is not just a bad period. So I hope you guys will hang in there with me. Stick it out through the rest of the month for all the good stuff that I have going on. And keep fighting with me. I'll see you guys later. Alrighty, peace.